Many times we need to keep our health in check, but don't know what questions to ask or where to begin. We walk in blindly to our healthcare provider and walk out none the wiser, and maybe even more confused than before. Can you take charge of your health and arm yourself with the questions and preparedness you need? The answer is yes. Welcome to Occupy Health with Dr. Susan Downs. This program will answer your questions and give you the best practices for facing your medical partner in good health. Now, here's Dr. Susan Downs.
Hello there. This is Occupy Health with Dr. Susan. We have talked to many people about nutrition and various medical conditions and how we can be proactive in our health. But we have not delved into the area of mental health, which is very complicated and probably is interconnected with all the other ailments one can think about. So today we have the honor of having Dr. James Greenblatt, an integrative psychiatrist here, who's we're going to discuss these matters. Dr. James Greenblatt is the Chief Medical Officer and Vice President of Medical Services at Walden Eating Disorders Program in Massachusetts and Connecticut. He is board certified in child and adult psychiatry. He received his medical degree and completed his adult psychiatry residency at George Washington University in Washington, D.C., in the medical school, and he completed a fellowship in adolescent psychiatry at Johns Hopkins Medical School. In addition, he is a clinical faculty member in the psychiatry department at Tufts Medical School, as well as the Giselle School of Medicine at Dartmouth College in New Hampshire. He lectures extensively. He is the author of 6 books, including Answer to Anorexia, The Breakthrough Depression Solution, Answers to Binge Eating, Integrative Therapies for Depression, Redefining Models for Assessment and Treatment Preventions, Nutritional Lithium, The Cinderella Story, and his most recent book, Finally Focused, which looks at the enigma called attention deficit disorder. This book is available this spring, and so welcome, Dr. Greenblatt.
Thank you very much. It's good to be part of your show.
It's our honor. Okay, so let's get started. What got you interested in this? What is an integrative psychiatrist?
An integrative psychiatrist is typically a traditionally trained mental health professional, a physician, who kind of has stepped out of the medical model of just thinking medications are the answers to kind of all of mental health problems. And the word integrate is a critical part, integrating nutrition, metabolic, lifestyle, and environmental factors to treat both major mental illnesses as well as stress and anxiety that are just so commonplace in our society.
What got you interested in this pathway?
Well, I kind of went to medical school many years ago thinking, I was going to cure the world with brown rice and kale, and I realized it was a little more complicated, and became a traditionally trained psychiatrist, and realized that model was limited, and kind of went back to my interest in nutrition and brain health, and it's been kind of a part of my career for over 30 years now.
Wow. So nutrition plays a big part in most mental disorder, like in depression and attention deficit disorder?
I think it's a critical component that's just tragically missed. It is not, the answer to everyone with a depression or ADHD, but there's, for many, there's some very simple testing or simple interventions that can really turn around the course of these illnesses, and it's just not looked at enough.
What about schizophrenia? Because I kind of look at that as, it's a whole bunch of different diseases, but that seems very difficult to help people with.
Well, it's interesting that you brought that up, because that is my next project, and that is something I'm just passionate about, because our treatment of schizophrenia has gone to a very, very heavily medicated model as the only solution, with disease from these medications, diabetes, obesity, and really significant impairment in life. And I'm comparing the United States from Europe, which is much less medications, and there are many kind of nutritional, and we use the term orthomolecular, which is high dose of certain nutrients that can actually help treat schizophrenia. So that is the project I'm working on currently.
Well, I used to work for the NHS, and our approach was somewhat similar to the approach in the United States. At least the part of it that I was in, it was very heavily medication focused. So there is something else we can do for these folks, or do we have to keep them on the medications while we look at these other things and then gradually lower the medications?
That is actually my ideal. I mean, I'm frustrated with the kind of anti-psychiatry movement. You never need to use medicines. And I'm frustrated with traditional psychiatrists where that's you telling patients you have to be on medicines for life. Someone comes in with psychotic episodes, we can decrease that and eliminate those quickly, often with medications. But as we delve deeper into the problem, we've seen everything from B12 deficiency to infections to other vitamin deficiencies to GI problems that play a role in that process that we're calling schizophrenia. So if we treat all these underlying illnesses, actually vitamin D deficiency is very common in psychosis and very simple to treat. So if we treat all those underlying pieces while someone's on medicine, as you said, we can get them off quickly and they can be much more functional.
Well, maybe at a minimum we can lower the medications because these do have such serious side effects. I mean, and gluten and diet and gut, I think, will be a huge part too. Also, I understand schizophrenia is probably a whole bunch of different diseases. It could be leukodystrophy, just about anything. So it really takes a lot more thought and time than I think that we have time to give.
Correct. Yeah. So we just need a different approach, and we need an integrative, comprehensive approach.
I am certainly looking forward to that next book. In the meantime, let's get back to attention deficit because this is increasing so much in our society. I mean, it's increasing so much. Maybe this is environmental toxins, maybe things like EMF, maybe diet. I mean, who knows? But it just seems to be rampant. So, do you find nutritional deficiencies in ADHD? Well, first of all, why don't you tell people what ADHD is and what the standard of treatment is at this time?
ADHD is attention deficit hyperactivity disorder. It's the most common childhood psychiatric disorder, most common reason someone sees their pediatrician for behavior problems. So it's very common and it's increasing. It's much higher rates in the United States than in many European countries. And the disorder, untreated, really can be disabling through school age as well as adulthood. So I think the disorder is real, but what's happening is certainly our culture looking for that quick fix solution. We have medications, we have amphetamines that can help treat this disorder. So kids function better on these medications, and parents kind of seek that relief, but oftentimes they are missing nutritional and metabolic problems, and oftentimes there are side effects to the medications, or the kids can't stop taking the medications and function.
Yes, I've had parents beg me to put their kids on those medications, and that's just the way the world was. I guess, parents are concerned about the behavior. So are there environmental factors involved? Are there nutritional factors involved?
I think all the above. What you had mentioned, I think it's clear. The research on pesticides is quite clear now. So pesticides, insecticides, environmental toxins like lead and mercury. People in this country got a lot of exposure to high lead with a water crisis in Michigan, Flint, Michigan. And so people started looking back at research that's been done for 30 years, and rates of ADHD of those that had lead poisoning are 40, 50%, very, very high numbers. So many environmental toxins and the nutritional deficiencies, magnesium, zinc, and iron, all associated with ADHD.
Wow. Also, I've read studies that if you expose a fetus to electromagnetic fields or cell phones, the kids, when the offspring of rats grow up with, brain disorders, decreased hippocampus, cerebellum disorders, but also studies have showed increased anxiety and difficult behavior and some increased tendency for ADHD. Now, I don't know how they're going to do that study because it's very difficult to find a control. I mean, on humans, because I understand cordless phones are worse than the cell phones, but at least in animal studies, this has been shown to be the case. So it's just probably a whole combination of environmental factors that are making this disease so prominent.
Yeah, well, certainly the use of just routine screens, TV screens, the iPads for these infants are a factor. And the other factor that the research is quite clear about, not as communicated as much to clinicians, is sleep deprivation. So sleep problems in infancy and childhood predicted ADHD, and sleep problems throughout adolescence have a very profound factor on the symptoms of ADHD.
Well, could ADHD sounds like a big catch-all term. Could some kid just be anxious or a little bit nervous or difficulty focusing? Or a lot of people who don't have ADHD that are put under that rubric?
Yeah, I think that there are some circles where ADHD has this kind of negative connotation as an illness, and there are other kind of communities where ADHD is seen as a strength. The symptoms of high energy and passion and excitement and being able to juggle or multitask. And these are some of our most successful individuals, from CEOs of corporations to inventors. People make jokes of Einstein and Edison and, some of other individuals. So ADHD symptoms are not necessarily good or bad. It's really the environment that those symptoms become evident in.
Well, since I've received that label, I really like that spin to it. So,
yeah.
Okay, I like that. Okay, so if you're a parent of a child that seems to have these conditions and your physician says, okay, here's your Ritalin, what else can the parents do? I mean, do they find an integrative psychiatrist, or can they start investigating this on their own?
I think the way we wrote this particular book, Finally Focused, was to help parents be able to pursue the information on their own and to obviously work with their doctors. But something simple like magnesium, which is, I believe, one of the most common nutritional deficiencies in ADHD, it can minimize the side effects to Ritalin. Often kids get anxious on the medications, irritable, and those symptoms will go away with magnesium if someone is taking the stimulants like Ritalin. Often, Ritalin, it's a short-acting medicine, so people can stop and start it. Summer vacations, they might not be on it. So looking at a nutritional approach over time can really help families, help sometimes their children be able to stop the medications.
I read your book and I found it absolutely fascinating. You go through a series of sequential steps to look at various supplements and vitamins and steps, and I found it very interesting. So when looking at supplements, what other things should the parents look at or get tested for or ask their physicians to test for? Well,
I think it's really important that the routine screening tests in their pediatrician's office, things like iron deficiency and lead, could be done by every pediatrician. And then the outline in the book looks at testing that one would need more of an integrative practitioner, a nutritionist, or naturopath, or a physician, looking at some of the other things we talk about, like food allergies, urine tests, looking at the gut, looking at heavy metals. Those tests are not routinely done by most pediatricians.
Okay. Also, in your book, it said that dark chocolate might help because it regulates epinephrine and norepinephrine and decreases glutamate. So, might dark chocolate help some?
Probably, yeah. I'm a big fan of a class of what we call phytochemicals called OPCs, and these are kind of what's a molecule in plants, and it's kind of the colors. So it's the blueberries and the green tea, red wine, and the dark chocolate. And we have shown, we actually did some research that they can help attention, help cognitive function, and so yes, dark chocolate can be helpful.
Also, what the dark chocolate can do, it can slow the production and release of histamine, protect against lipid peroxidation, which is hugely important, strengthen the blood-brain barrier so all sorts of unpleasant things don't get into the brain, and it increases the enzymes that decrease inflammation. As we've heard from many speakers, inflammation seems to be at the root of just about any disease we can come up with. So I think that group, the OPCs, is very important. Now, what about pine bark?
Well, pine bark is one of the original kind of OPCs, and so that's something that is easy for me to talk about with my colleagues because there's research. So there's research studies from around the world looking at pine bark extracts, pycnogenol, and these are concentrated sources of OPC, and these have helped. They've helped attention, ADHD, and other kind of cognitive symptoms. So it's always nice when we have research to support the recommendations we're making.
Yeah, as your book said, it increases alertness, focus, decreases impulsivity, restlessness, aggressiveness, and it decreases oxidation, and helps clear thinking. Very important. You also mentioned green tea.
Yes, green tea also, lots of research looking at kind of cognitive decline in the elderly. Again, some of the active phytochemicals in green tea are these OPCs, and it's important that for ADHD, certainly for many adults, sometimes OPCs have been the only treatment that we've used with lots of success.
Now, also interesting in your book, now, audience, I'm going to mention lithium, but it's not the traditional lithium carbonate that the psychiatrist gives out. You were mentioning very low dose of lithium, which is actually a mineral on the periodic chart. So you were mentioning low dose is really helpful for ADHD and maybe other health conditions?
Yes, I've been looking and using what we call nutritional lithium or low-dose lithium for almost 30 years now, and I think it has tremendous implications for many psychiatric illnesses. Lithium is a essential nutrient that's in our soil, and we get it from our water as a source, and depending on what community you live in is how much lithium might be in the water supply. And the original research showed that areas where there's low lithium in the water, there was much higher incidence of depression, suicide, even violence and aggression. And areas where there are high lithium, much less. So as we started exploring this kind of nutritional lithium, there's growing interest in its ability to help prevent Alzheimer's and cognitive decline. And our work, we use it with kind of aggression in young children. So the kind of ADHD where these kids are very aggressive, maybe hitting, oftentimes either young kids that get kicked out of school or preschool, and looking at using low-dose lithium, micrograms, very tiny dosages, can be really dramatic.
Wow, that's very interesting. It also protects the brain cells, I understand. But that's very important. The audience, now we're not talking about the doses like 600, 900, 1500 that your psychiatrist might give you. He's talking very small doses that are protective for the brain and with minimal side effects. But you have to be a little careful with renal difficulties.
No, we never get either blood levels, so there's no detectable blood levels from these dosages. So we screen for thyroid and kidney, but we do not do ongoing lab monitoring because they're just not ever a problem.
Okay. You're also talking about like the effects of zinc and the zinc and copper ratio. They tend to be inverse. So tell us a little bit about that.
Well, zinc also is nice to talk about with my colleagues because over the years there's been a growing body of research demonstrating zinc as a mineral, low levels of zinc, and ADHD. And the research is so kind of large body now that it has a couple different roles. One, we found low zinc in many kids with ADHD, and two, we're able to demonstrate that zinc can treat the symptoms of ADHD. And then there's research looking at zinc with the stimulant medications for ADHD. And many countries routinely use zinc with medications for ADHD.
Yeah, so zinc helps increase the effectiveness of ADHD medications, you're saying?
Yes. Yep, there's studies looking at that. The important flip side of that is not only is low zinc the problem, but there's a seesaw with a mineral called copper. And so when zinc gets low, copper gets high. And probably the more common problem that is not as much in the research, but we have found it to be very significant, is elevated copper levels.
Yes, I believe Dr. Walsh will be on the program within a few weeks, looking at copper very seriously as well. But doesn't melatonin, which regulates our sleep and, kind of is a counterpart to cortisol, doesn't that rely on zinc as well?
Yes, you need zinc to convert serotonin to melatonin. So the zinc deficiency we see across many psychiatric illnesses like depression and anorexia nervosa. Sleep difficulties are very much part of that.
It also stabilizes the neurons and helps the coding of the neurons. So that's a pretty important piece of this puzzle as well. And the seesaw factor of too much copper is a problem as well. So this is, all these things that just like, I suppose each kid is different, and you have to look at all these components. And we're going to get to the gut fairly shortly. But it's in your book, you kind of have a formula for helping the parents go through this step by step so they can start either asking the questions or, pursuing these different pathways. You have this in a very organized manner.
Well, as, we go through, I wish it was simple, like the one pill mentality, but every child is different. And to simplify it, we came up with what we call the plus-minus plan, where we kind of help parents think, are there things that we need to add into either someone's diet or lifestyle, or there are things that we need to take away, toxic minerals, and things like that. So that's why we call it the plus-minus plan. And we outline the book as to the simplest and most important. That's why magnesium is the first chapter, OPCs we talked about. And then as it progresses, these are kinds of important adjunctive treatments, but wanted to make it very simple for parents.
So can parents do these on their own? Obviously giving blueberries and giving a little bit of zinc and stuff, in those cases will be very helpful for the overall health. So could parents just start doing this on their own without, interacting with their doctor as normal?
Yes, many of the things here could be done on their own, whether it's a lifestyle, mindfulness exercises, dietary recommendations, supplements that they can get over the counter. Absolutely.
Okay. Now, you also talk about the role of the gut. What is the role of the gut with respect to ADHD or other mental illnesses as well?
Well, we're finding, and with very impressive research at a very, very fast pace, that the nervous tissue in the gut and the microbiome in the gut, the bacteria in the gut, which are 4 or 5 pounds of bacteria, which is almost as much as the brain weighs. So there's that much bacteria in our gut, has important functions that affect our brain, essentially affecting our mood, our behavior, and can result in severe kind of neuropsychiatric symptoms. So we look at it a few ways. We look at testing for bacteria in the gut that might produce chemicals that we know affect the brain. And we also look at utilizing healthy bacteria called probiotics and prebiotics to support the gut. And there's a subset of ADHD kids where that is a problem, and there's probably a larger subset of other psychiatric illnesses where the GI tract is very critical to healing and recovery.
Yes, so I find out that it affects a certain, can attribute to autism or certainly subset of their problems. But does it? What is its role in depression or schizophrenia?
Well, I think it's complicated. I don't think we know all the details, but there's one bacteria. There's a form of Clostridia, which is a bacteria that's normal in the gut, but there's certain strains that produce a chemical. And the chemical is a long name, but the abbreviation is HPHPA. And this is detected on a simple urine test. And this chemical interferes with the production of norepinephrine in the brain and the breakdown of dopamine. And by testing this chemical, we're able to predict symptoms like schizophrenia, because if we have this elevation of this chemical, we need to kind of use high-dose probiotics in the gut. And we've seen symptoms of psychosis and agitation completely disappear with high-dose probiotics. Now, again, not everyone has elevation of this HPHPA. Not everyone has a gut problem, but many do, and it's just really important that mental health professionals start looking for those individuals.
Well, we're coming to a break now, so Dr. Greenblatt and myself will be back right after the break.
Follow us on Twitter at VoiceAmericaTRN. Get the lowdown on guests, new shows, and your favorites. That's VoiceAmericaTRN.
Did you know that nearly a third of Americans have made us the #1 country in obesity rates in the world? It's true. It's time for Right Choices. Tune in every week for the show that aims to make you healthier. You don't need a lot of time, money, or even need to travel far. Host Dietrich Wright will show you what you can do easily to be more fit, healthier, have more energy, and live a better life overall. Be sure to make us a part of your weekend every Saturday at 11 a.m. Pacific Time, 2 p.m. Eastern on Voice America Health and Wellness.
Addiction can affect our relationships, our families, our home, and work lives, but most importantly, ourselves. The recovery process can do wonders in the lives of people suffering from active addiction and also for those that love them. It's not just 12-step programs, but so much more. It's learning how to live life on life's terms. If you can relate to these issues or love someone who does, start with yourself. Start by tuning in to Miracles in Recovery with host Ray Lynch, Mondays at 8 p.m. Eastern Time, 5 p.m. Pacific Time on the Voice America Health and Wellness channel. Hope is in your corner.
Do you find yourself caring for people in multiple generations? Are you exhausted, stressed, and overwhelmed? Instead of spending hours searching for resources and information, Dr. Merrill and her guests will provide you with practical, everyday information and solutions to help make your life easier. Tune into Caught Between Generations, Thursdays at 12 noon Pacific Time, 3 p.m. Eastern Time on the Voice America Health and Wellness channel.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Occupy Health with Dr. Susan Downs. We'd love to hear from you about today's show. Send your email to Dr. Susan at occupyhealth.com. That's Dr. Susan at occupyhealth.com. Now, back to this week's program.
Welcome back to Occupy Health. This is Dr. Susan, and with me, I'm talking with Dr. Greenblatt, who is an expert in integrative psychiatry and treating various mental disorders with multi-modalities, including nutrition, exercise, sleep, stress management, mindfulness, etc. So those of you that know somebody dealing with a mental disorder, or you have some challenges yourself, this is something you might want to seek out. Okay, so we were talking about that Canada can generate a chemical called HPHPA that has adverse effects on the brain, making the child more agitated and aggressive. And he was also saying that giving probiotics for this particular subset of ADHD kids, helps increase certain neurotransmitters such as serotonin and GABA, and helps them calm down a little bit. So that's very interesting. What other things can you tell us about how the gut affects our mood and mental well-being?
Well, a number of our kids with ADHD had high dose, or not necessarily high dose, but had multiple antibiotic trials for ear infections. So oftentimes we get overgrowth of yeast in some of our kids with ADHD due to this multiple antibiotic trials. So the antibiotics kill both the good bacteria and it sets the stage for growth of candida and yeast. So oftentimes we need to address the yeast overgrowth as well.
Okay, so how would we tell if a kid might have yeast, or if we might have yeast?
Sometimes, there are other yeast infections, so there could be yeast in the mouth and in the gut or on the skin. But oftentimes, for our kids with ADHD, we can do two tests. One, that same urine test, it's called an organic acid. We pick up metabolites of yeast that only come from yeast. And so these are chemicals that we know shouldn't be in the body. If they are, there's overproduction of yeast. And then we can also look at stool samples for overproduction of yeast. The clinical symptoms of yeast are often sugar cravings, moodiness, irritability. So kind of very common symptoms that a lot of kids would have. So they're not specific, but if we put some of the clinical with the testing, we're best able to make that determination.
Don't yeast like sugar a lot?
Yeah, the high cravings for refined sugar certainly is part of it and makes it worse. So we get in that vicious cycle.
Yeah, and going back to Clostridia, another thing that's interesting is because it affects a certain enzyme, the dopamine levels go up. So if you give these kids Ritalin, these kids might get worse if they've got a Clostridia condition?
Excellent point, Tim. I think that there are two important points in the book related to children that have side effects to medication, which is common. So someone is put on a stimulant by the pediatrician, has irritability, anger problems, and can't tolerate the medicine. There are usually two things that we see. Elevations of HPHPA, as you described, and elevations of copper. And for those that are interested in medicines, once we treat those two problems, some kids have both, some kids have one, then they can tolerate the medicine without side effect. But yes, this elevation of HPHPA makes it very hard to use a stimulant medication with any efficacy because the side effects are very, very severe.
How interesting. I mean, you said one approach to when you've got high HPHPA is to give certain probiotics. What do you do if your copper level is high? Give zinc?
Exactly. Yeah, we would use high-dose zinc for an extended period of time. It's at least 3 months. And as the copper levels go down, then the other treatments work better. The OPCs we talked about earlier also kind of binds copper and helps bring copper down. So we use zinc and OPCs for elevations in copper.
So I understand in your book you lead the reader through a very methodical approach. You'd have them test for magnesium and lithium first, and then if this doesn't work in 1 or 2 months, you test for the HPHPA, and very logically you lead the reader through kind of a decision tree to help figure out what's going on.
And that's kind of self-help plus minus plan. I think there are physicians who could look at many of these tests in one visit, so looking at the urine test and the blood test to be able to go through many steps much more quickly. But that would take working with a physician.
So does the diet depend, do you have any particular recommendations for the diet, or does it depend on the results of some of these tests?
Well, I think the one consistent thing that both the research and we found over the years is higher protein diets to help kids with ADHD. There's some research that they don't metabolize carbohydrates well, and blood sugar spikes and drops in particular are common, so there's very erratic blood sugar from refined foods and carbohydrates. So I'm always recommending to the parents or to adults who have ADHD that higher protein throughout the day is much better for attention and for ADHD.
What about gluten?
Gluten varies. I think that we have kids, there are different ways that gluten can be a problem. So we have kids where gluten is a problem. It could be a wheat allergy, could be celiac disease, or gluten intolerance. And then we have other children and other adults where it's not as much of a problem. So I don't have a blanket, everybody should eliminate gluten, but what we see a lot is adults who present with ADHD for the first time. They do not have ADHD as children, and they present, or college students, with inattention, and the school psychiatrist puts them on Ritalin. We've picked up a number of celiac disease patients, and part of the issue is they become very deficient in things like iron and zinc very quickly from the celiac disease destroying the gut, and they have problems paying attention. But that's not ADHD, that's untreated celiac disease.
Well, doesn't gluten have many components, so the standard medical test for the anti-gliadin antibody might not pick up if you've got a sensitivity to gluten?
Absolutely. I think any of our kind of chronically ill patients, we talked earlier about schizophrenia, depression not resolving, that I always would recommend a trial off of gluten for patients with major psychiatric illness.
What about food allergies?
Food allergies in our young children, I think, is just a very neglected part of our treatment. These children under 6 that are now put on medications without any testing or treatment, the vast majority have food allergies. They could be to common foods like dairy and wheat, but it could be corn, tomatoes, avocados. We've seen anything, but for the younger kids, certainly under 6, but probably under 12, I think it's a critical part of an ADHD evaluation.
What are the signs, or what kind of things going on would make us wonder about food allergies?
There are classic symptoms or clinical signs that I think are easy for parents to see. And these are kids, you see that their face gets red, or oftentimes their ears get red, and what's kind of both humorous but not uncommon, parents will notice one ear getting red. So after they eat, or an hour after they eat, they might have one ear gets very red. So reactions like that, black circles under the eyes are not uncommon in food allergies. And the other part that we look at is cravings for certain foods. So oftentimes the food these kids are allergic to, they might have cravings.
So it might be a change in behavior, irritability, short temper, shorter attention span, loud talk. You just might notice a change in behavior plus, the things you mentioned. That could be a sign food allergy if it's after eating the offending food.
The physical signs are pretty common, but it's not necessarily as quick as what we think about as allergies, what we call the immediate hypersensitivity reactions, where someone gets a swollen lip or even shortness of breath. That is a different mechanism. The food allergies, they're called delayed hypersensitivity. So some of the symptoms don't appear for a day to 3 days. So we can't always correlate the behavior problems to right after a meal. Usually we see some of the physical signs, within a few hours. But it's much more delayed, and you need to kind of understand it and monitor it over a couple days. For years, people were recommending elimination diets, and there's lots of books on this, where you kind of eliminate highly allergenic foods and introduce foods one at a time. And that's where you might see behavioral symptoms come on very quickly when you introduce the dairy or the wheat after the child has been off that food for a couple weeks.
So this is going to be like a detective. The parents got to kind of monitor what the kid eats so they can test if they have a reaction when the food is reintroduced. Because
there is some detective work, but the good news now is we do have tests. So we can look at a blood test to see which food someone might be allergic to.
Which blood test would you recommend?
These are called, IgG food allergy tests. And a number of labs around the country do them. And they're not 100% accurate, so I don't want to mislead your guess. I think that the science and the research has not been done to prove it, but clinically, those of us who have been using it for 30 years, they're great guides, particularly for young children. You really can see the difference, their immunological response to dairy being very, very high, and you eliminate that food, and symptoms, psychological symptoms, behavioral symptoms get better.
And how would you compare the IgG test, the Cyrix test, the ALCAT test? Any preferences among those?
I've just been using the IgG as a kind of screening test for many years, so that's what I'm most comfortable with. I think that all those tests you mentioned have some value to the kind of assessment for food allergies.
Now, I also understand that the pulse rate might go up, and there's a group is looking at the research of monitoring blood sugar changes and heart rate changes after eating a food. So would a quick test be to see if the pulse goes up?
Yeah, there was a book written a number of years ago called The Pulse Test, and absolutely, your pulse typically might go up 5-10 points after you eat, but oftentimes you'll notice going up 20 or 30 points, and that is a pretty reliable indicator of a food allergy or food sensitivity.
Well, that's quite an increase in the pulse. Do you have any recommendations generally for strengthening brain cells, which is going to be important to all the listeners?
Well, I think that there are certain kind of nutrients that would be supportive for, all of us, and those would tend to be things like magnesium, the omega-3 fatty acids, and the OPCs. So I think anyone looking at kind of preventing cognitive decline, looking at supporting brain health, those are the three with lots of research, and I think anybody could take those. Lithium, what we talked about earlier, I recommend for everyone kind of over 40 as a kind of prevention of cognitive decline because of its kind of neuroprotective effects. And then the most important part of my work is that detective work that you described. Individually, there could be a whole host of nutritional, metabolic, or hormonal things that should be addressed for that individual to help their optimal brain function.
Okay. What about diet? What would you recommend?
I think that over the years, there's been so many diet studies for so many different things, and one thing that is the only consistent thing that I've read in 30 years is not what people are eating, because people can be healthy on multiple diets if you just look at world cultures. It's what they're not eating. So my strongest recommendation is the elimination of refined sugar and junk food as detrimental to mental health. So we have very healthy vegetarians and we have very healthy meat eaters. So I don't think there's one perfectly healthy diet, a kind of moderate diet, but I do think there are some unhealthy diets.
What about artificial sweeteners?
I think the research certainly around, eating disorders and other mental health problems, they're almost as bad, if not worse, than the sugar.
What about breakfast? Do you recommend, high protein and a low glycemic index breakfast or low glycemic load?
Well, absolutely. For our ADHD kids, the higher protein, lower glycemic load is going to help regulate blood sugar throughout the day. And as I said earlier, that's these kids, there is some research, and we see it all the time, that they're much more vulnerable to ups and downs in blood sugar. So the more consistent dietary, low glycemic approach we can take, much better results with treatment. And the adults with ADHD see this most easily because they can experience it for themselves.
What about sleep? You mentioned that was extremely important. What if the child or ourselves are having trouble with sleep? What would you recommend?
Well, important to assess any sleep disturbances. So very high rates of ADHD with sleep apnea. So we're seeing apnea now in young kids, sometimes related to weight, sometimes not. So sleep apnea should be assessed, certainly if anybody is snoring. So sleep specialists might need to be involved. What we have also found is the ADHD kids tend to sleep less, so they have insomnia, they're up at night, and I'm pretty aggressive about making sure kids are sleeping adequately, and we look at, again, magnesium can be very helpful for sleep, melatonin has been very helpful for sleep, or sometimes we can use nutritional supplements like glycine and theanine to help our kids sleep. But I just would not let it go, and many parents are just kind of throw their hands up and say, my kid's up till 2 a.m, there's nothing I can do. I think it's a physiological problem. Sleep deprivation creates havoc with inflammation, and so treating decreased amount of sleep is an important part of our ADHD treatment plans.
What about tryptophan?
Tryptophan we use regularly, certainly for adolescents and adults, and it's been a great sleep aid. And so each tryptophan pill is 500 milligrams, and sometimes, depending on the age, 1 gram to 3 grams of tryptophan can be very helpful for sleep.
Now, if a person has sleep apnea, is there any other alternative other than the CPAP machine?
The two treatments that seem to have made a difference for individuals would be a CPAP or dental appliances. So there are dentists now that just specialize in sleep apnea, and these dentists are able to create appliances that kind of move the jaw forward and opens the airway. And for many individuals, it's easier than the CPAP, and for some, it's just as effective.
So I just want to reiterate for the audience that good sleep is extremely important for ADHD, mental disorders, and for all of our health. That poor sleep, as well as poor exercise and poor stress, are all risk factors for cardiovascular disease, dementia, etc. So our sleep is essential. And so what about exercise? What do the studies show on the effect of exercise with ADHD?
Well, I think there are many studies across lots of psychiatric illnesses. Depression and ADHD probably has the most in terms of the relationship to improved symptoms. So we know exercise increases chemical hormones, neurotransmitters, these peptides. Probably the most important is something called BDNF, a peptide, brain-derived neurotrophic factors that both enhances mood. And the studies looked at kids, and kids who have exercised have improved symptoms. So we know that's important. And if you talk to anybody with ADHD, as I've been treating thousands of kids and adults over the years, they function better after they exercise. Oftentimes they plan homework after they exercise. They plan any sustained attention task after they exercise. So the other part of that is nature. There's research looking at ADHD kids in nature. So what I was thinking about is exercising in nature is ideal. So just being in green spaces has improved attention for kids with ADHD. And there are a number of studies looking at what's been called vitamin N for nature.
Okay. Well, could being in the nature kind of correlate with mindfulness?
Absolutely. Mindfulness has, by itself, been looked at with ADHD, and intuitively, we don't think an ADHD child would benefit from meditation or mindfulness techniques, but very good research and very kind of helpful mindfulness programs have resulted in sustained attention improvement. I like to work with kids on what I call kind of walking meditations or walking mindfulness. So I don't ask a child to sit or ask a parent to do that kind of mindfulness, but you can use mindfulness techniques as our child is either walking in nature or doing any kind of activity. It's really kind of helping the brain kind of be in the present and not be kind of thinking of the past or the future. And we can teach these kids exercises that can really kind of help them be mindful and over time improve symptoms.
Can you give us an example of, exercises that you might have a hyperactive attention deficit kid do?
Sure. Well, there are two things that I ask parents to routinely do. Let me start with the most important, I think, is listening to the child. Too many times we have our own expectations of what we think a child should do, how they should study. So I try to set up listening times where parents will ask their children, how do you study best? This comes up a lot because the parents say, shut the music off, close your phone, you have to be in a quiet room, where a child might do best with the music on and standing up. And so one is that listening, and the second is, some of these, what I call mindfulness walking exercises. So walking with your child, ideally in nature, but whatever's convenient, and then helping and teaching some mindfulness techniques about just being aware of their surroundings, what they're seeing, what they're feeling, how they're hearing, their body, as well as the world around them. So it can be very open, what's comfortable for the parents, but keeping the kids moving most of the time is the easiest way.
And what exercises would you recommend for a child? How would you get a kid moving?
The most successful programs have really been martial arts. There are obviously many athletes who love, organized sports, and these kids are busy doing their sport activities. But the martial arts are really available to the younger children, to girls and boys, and they tend to enjoy it, and we see dramatic improvement in attention, and that's part of the training. And it's always amazing as parents, they say their kid can't sit still, and they watch them in the martial arts class, standing still for large periods of time. So martial arts is one, but really any exercise program can benefit.
Any other particular recommendations if martial art programs are not close by?
The walking, exercises, or any kind of yoga programs. Again, we don't think of ADHD kids as participating in yoga because they can't sit still, but we've started some kids and they just kind of fell in love with it, and it's their time to be able to focus.
Now, you've made recommendations how best to communicate with kids with ADHD, so can you tell us about that? Again,
the problem is just over time we tend not to listen to our kids because the ADHD kid kind of sets himself up because he might be impulsive or overactive as a behavior problem, that our reactions tend to be critical. And we know that kind of harsh, critical parenting makes these symptoms worse and certainly affects self-esteem. So we're looking for a communication style where parents will kind of ask and respect and understand the illness. As we understand ADHD, parents are better able to kind of tolerate the symptoms and find different environments where the kids are going to do better, one-on-one, more structure. And one of the quotes in the book that I like, that I use all the time with parents, is think of your child as a handful of sand in your palm and holding that sand very gently. And I have them imagine what happens if they squeeze too tightly with that sand. Well, the sand goes through your fingers. So I'm just recommending that parents don't squeeze too tightly. Constant punishments for what I call a neurobiological disorder, it does not help the outcome.
And to stop criticizing as well. So it sounds like, as we're coming to a closing, that ADHD, like any other illness, and the mental illnesses as well, could have so many different things that are contributing to it. So it's like a big puzzle. So in our last 2 minutes, are there any final words you'd like to say or give information on how to get a hold of you?
Well, I think it's just really important that parents understand medications can be used safely and effectively, but they're not the answer. And I certainly recommend for children and adolescents that parents look at nutritional, metabolic, and other kinds of lifestyle changes first. And if medicines are necessary, some of the nutritional approaches in the book can kind of minimize the side effect. So the book that we wrote is called Finally Focused. The website is finallyfocusedbook.com. We have the research studies. We have some courses and videos that are available, and for helping parents and adults get the treatment that can help.
This book is very well written, and it's a very logical pathway with a lot of explanations. It's very clear so that anybody in the audience might pick it up and be able to go through this process and help the physicians go through it as well. So it's an excellent book.
Great, thank you.
Okay, any other final words? We have 1 minute left, so any parting words?
Well, I started mentioning it, but I just share again that adults with ADHD are kind of a population that's neglected and not often treated. But adults with ADHD have much higher rates of divorce, financial problems, even prison sentence, traffic accidents. I mean, you name it. They struggle. And
okay,
if they
we
don't find the right
are
environment.
at this point, sorry, we're coming to an end. So I recommend that you all check with your health providers. Maybe you can help them with suggesting these tests and have them read Dr. Greenblatt's book. So go do your own research so you can help yourself and help others. So be well.
Thank you for listening. Occupy Health with Dr. Susan Downs can be heard live every Friday at 2 p.m. Eastern Time and 11 a.m. Pacific Time on the Voice America Health and Wellness Channel. Here's to better health for you this week.